Welcome to our next feature presentation during the global pandemic. Midwifery Wisdom has been looking at different scenarios, different experts, and we've been looking at this global pandemic from different perspectives. Today we have the really honor of talking to several real live people who I happen to know or know who they're friends with that actually are COVID positive. They've come on the conversation today to share the timeline of their illness, the symptoms, how they got testing and treatment, and how they're recovering now, which is really just amazing to get to have such a real firsthand view. I've also asked a medical professional to be here with us, Ariana, who is currently treating COVID patients every day. So we're going to get to look at both perspectives. Let's start with a little intro. Let's move. Shayna, can you start us off? Will you tell us your name and where you are? A simple timeline of your infection and testing. What's going on for you?
Sure. So my name's Shayna. I live in Chicago. I first got my first symptoms on March 9th. That was a Monday. It was, very mild, like sore throat, achy joints. Lasted for a couple of days. Nothing I would have ever gone to a doctor for. And by Friday of that week, I felt a lot better. But my partner got sick on March 11th. And he was sick for a lot longer than me and much more severe. We did a telemedicine appointment on March 17th, and the doctor said we had the flu, which made sense because I'd gotten a flu vaccine this year and he had not. So I'm like, okay, that makes sense why he's so much more sick than I am. But he had high fevers for the rest of that week and passed out a couple of times, and I finally took him into the ER on March 20th. They saw him for the flu and it came back negative. They saw him for COVID and he got the positive result on March 22nd. Then, since I was exposed, and 38 weeks pregnant, I was able to also get tested. And my positive test came back on March 29th.
Wow, what a month-long ordeal you've been in. Yeah. And so I'm imagining you're still pregnant.
Yes. My estimated due date is tomorrow.
Oh my gosh, congratulations. What a crazy, crazy time.
Yeah.
Well, we'll talk about that again more. Thank you so much for agreeing to be on the call. And I really appreciate your sharing. Natasha joins us with her roommate. Natasha, say hi and introduce both of you.
My name is Natasha and I'm from Marysville, Washington. I started having symptoms around, I'd say like March 16th, but then started really feeling pretty crummy around the 18th of March. The following week on Tuesday, I went in and tested, went to one of the drive-through facilities and got tested and found out 3 days later that I tested positive for COVID. So it's been quite a struggle. I'm on like 3.5 weeks right now. So it's been, I'd say my second week was the worst. So I'm kind of glad that, I'm kind of coming out of that. So,
okay.
But yeah.
Well, we are glad you are too. And because we are in close proximity with our roommates, oftentimes they're at risk, like Shayna's husband, and now it looks like your roommate. Hi, welcome. Tell us about your experience.
So my name's Robin. I started feeling, I'm about 4 days behind her. So I really noticed a lung burning sensation before anything. Really dizzy, lung burning, kind of at the top of your throat, like when you go down a ski slope for the first time or go running in the cold. Yeah. And then it kind of went from there, and then real dizzy. I was having a lot of neurological things happening in the beginning, meaning muscle twitches. I was feeling like brain zapping. I was seeing auras around everything. Everything had a color band around it. And I was very off balance, floating. It was very weird. And then I lost my complete loss of taste and smell. Yeah. That completely went away. I never had a stuffy nose, but I just lost that scent, that ability to taste or smell anything.
Everybody in
Wow.
our household lost it. We all lost it because my husband had it too.
Wow. Wow.
So
Well, we're
my
going to
daughter's
come
the
back to
only
that
one
for
that has,
sure. That's,
yeah.
say it again.
Oh, my daughter's the only one that hasn't shown any symptoms, so we're
Okay.
pretty blessed.
Okay,
So.
well, we'll definitely come back to that. Thank you both for being here, and I'm going to encourage you to unmute your computer next time you talk, because then we'll see you. I think because right now we just see the phone icon.
Mm-hmm.
But either way, if there's an echo, we'll turn it off. Christine has joined us from very, very far away. Hi. So Christine and I got to have a conversation about her treating potentially COVID positive people, because she is a Doctors Without Borders, Médecins Sans Frontières volunteer in Bolivia right now, treating a clinic full of clients. And then a few days after we talked, she got sick. So will you tell us your story?
Yeah, mine's a little bit more recent than other people's, it seems like. I mean, I'm still in the middle of this. Right now, because I have to be up out of bed if I'm not in a better position, I need supplemental oxygen. So it's harder for me. First of all, I'm at 13,000 feet in the Andes. And so I'm already a little oxygen deprived as a healthy person. But when this hit me, then this is one of my major symptoms, is just kind of gasping for air. I have a pulse ox, and so I know that I'm satting at like 86 to 88%. So I'm okay. But the supplemental oxygen helps me, especially if I need to talk to you, because I need it. Really, I need a mask right now, but I'm using the nasal cannula because it helps a lot. My symptoms started when I was working at one of the clinics doing a 48-hour shift on the 27th of March, which was very recent, really. And it started with dizziness and shortness of breath, like I'm having. We had like 5 people in labor, and we had a fetal demise, and we had all these problems. A baby with meconium aspiration, and I had to transport that baby. It was just a mess. So I didn't have time to take care of me, but I knew something was wrong in my body. And so it wasn't until the morning when I could have one of the doctors take my blood pressure, and it was very high. And I have no idea why, because I don't suffer from hypertension. I'm 57, but I don't have hypertension. So I just chalked it off to altitude. But then I got a very bad headache that was like no other headache I've had before. Then that was a Sunday, and then the Monday, which would have been the 29th, I think. I was in the hospital for 4 days. And then after I got a fever, I got a positive test result. This is the abbreviated version, but still have the symptoms of low oxygen and low energy, and I have a cough, which I'm sure you'll hear at some point this evening. But I'm a lot better now.
Well, I'm so grateful that you're willing to talk to us, and even feeling as poorly as you do. Thank you so much, and certainly I want to talk more in just a little bit. Thanks for being on the call. We're going to go to Elliot Berlin now. Elliot, you've had a nation of people praying for you and thinking about you. Dr. Elliot Berlin is the much beloved prenatal chiropractor in Southern California. And we heard on social media that you were not feeling well. Will you give us your intro and walk us through the symptoms?
Sure. Thanks so much for putting this together. It's really interesting to hear how it kind of affects everybody differently. And it's hard to tell from the news. there's not one set of symptoms that make it clear that you have coronavirus. So
Yeah.
this is really helpful. Mine certainly started with what I thought was very atypical. I had a digestive discomfort. I had diarrhea, upset stomach, and a fever. Lasted about 3 days. I had kept reading that it's not really, that COVID doesn't really affect you that way. So I did not think that I had it. I didn't think I'd exposed to anybody who had it. And so I would have been really surprised. On day 3, I called the doctor. They were mostly just doing telemedicine. And so they said, it sounds like a digestive virus. Give it another couple of days. Fever will probably break and I'll start to feel better. 2 days later, it did not break at all in either way, the digestive or the fever. I was about 102.5. And I don't think I've had anything like that since childhood. I called them back and they said, well, it's probably a digestive bacteria, although they did say at that point it could be coronavirus. They gave me a prescription for the bacteria and antibiotic. But before I was able to get it, I developed a cough. And within 2 days, that cough turned into very hard to breathe, a lot of pressure on my chest, and I couldn't sleep anymore. And I just said to my wife, we did go pick up that prescription, but I mean, someone went to pick it up for me. But my wife's, I just said, look, I got to go to the ER. Something's wrong here. I cannot breathe. And from the minute I got there, they took us right in. It was not chaotic at all. And they did a chest x-ray really quick, and they did a COVID swab. They knew the COVID swab would take 24 to 48 hours, but just looking at the chest x-ray, they were 90% sure that I had COVID-19. And, you know, they admitted me to the hospital. At first, I was doing well with just oxygen, regular nasal cannula oxygen. But on the second day, it got worse. I couldn't keep my oxygen saturation up, so they moved me to the ICU. I came very close to ending up on a ventilator, but you know, on the night, it was a Saturday night, I had this episode where I just could not breathe at all. I thought I was going to die. I could not get any air into my lungs. It takes a little while for the nurse to come in because they have to suit up in pretty much full hazmat gear. So a few minutes delay there, I just really thought I was going to die. She came in and just with a little coaching, I was able to get some air, albuterol. She quickly brought albuterol inhaler, which helped a little bit more. Took about half an hour to break that episode, and about 2 hours for me to just be able to start breathing poorly again. In the morning, the doctor came in and said, we really think you should go on a ventilator. But something happened that night. I started to look at the social media, and I just picked up my phone. There's no visitors allowed, which makes a lot of sense, but it's kind of lonely. It makes it harder. And I just picked up my phone, mostly to message my wife, and I just saw all these different messages pouring in on Facebook, Instagram, text messages, WhatsApp, people just finding out and praying and setting up prayer circles, sending love, sending stories. I mean, people I haven't seen in 20 years, sending stories about how, I helped them when they were pregnant, and I didn't even know, what I did was all that meaningful to them. And I would just say all these stories coming in and prayers coming in, even though I felt deathly, my spirit was definitely opened up. My spirit was lifted. I felt deep, deep inside me some kind of relief. I'm not really a crier, but I cried like a baby all night reading those comments and messages. And it was very cleansing and uplifting. In the morning when the doctor came to say, we think you should go on a ventilator, it was about an hour before that I started to breathe a little bit better. And the nurse who had been monitoring me very closely said, Doc, I just want you to know there's been a little improvement today. And so he said, let's wait 12 hours. And by 12 hours later, a little more improvement. And since we were headed in the right direction, even though it was still pretty tough, he said, let's hold off. You may be able to avoid this. And I would say about 3 days later, I was able to get off the ICU. They offered me, and I took them up on the Plaquenil, hydroxychloroquine, together with IV antibiotics. And they said, we don't know if it works or not, and there are some potential side effects, but it's all we got. And so I did it. I can't tell you what worked, but I did start to get better and better. Now it's been about 16 days since my original symptoms, and I'm home, and it's incredible to be around family. But also, I'm very weak. I get winded really easily just folding laundry, but I'm getting better every day.
Wow. God. Thank you so much for sharing your story. And I got a little misty and teary. You know, one of the things I think we're all doing as a nation, as a globe, is facing our mortality and erasing some of the idea that we have such invincibility, which has sort of has been status quo. And it's so meaningful to connect in that deep way with your community. And I'm so glad your community did rally for you in your time of need. And certainly, lots of people were messaging me, do you know, how is he? What's going on? And I'm like, I don't know. So I decided I had to know, which is why I called you. And I'm so glad you agreed to be on the call.
Thank you. Sure.
Yeah, so glad you're here. Well, so I also asked Ariana to be on the call. Ariana is a childhood friend of mine, and we both veered off into the medical world. And when I heard that Ariana is currently actively treating COVID patients, I decided we had to hear from her. So Ariana, would you give us a little intro? Who are you? Where are you? What's your degree? What's going on? Give us an intro.
So I'm a nurse practitioner here in Cincinnati. I've been a nurse over 30 years. Most of my nursing experience was intensive care and emergency room. And I went back about 10 years ago to get my nurse practitioner degree. So currently I'm working at a local hospital. Generally, I'm a primary care practitioner, but as I have an urgent care kind of background, the bulk of my practice is overflow from the entire hospital system. And when I heard this was coming down the pike, I knew that my patient loads were going to drop because patients weren't going to come in. So I offered to go work over at the hospital. They set me up. I'm actually not actively treating the patients. I'm that person that's doing the testing. So I'm more of like the ER triage person. We have set up at our local hospital, massive tents kind of through the parking lot, so people can drive in and then of course not get out of their cars. We started our drive up like March 16th. And the first 2 days, we thought we had this unending supply of tests. And we found out very quickly after the second day that the local lab company says, stop, we can't run anymore. We can't take them. So they began to bump the test from one facility to the next, who bumped it to the next, who bumped it to the next. So I'm still getting lab results back that we did on the 16th from that awful nasal pharyngeal swab you all had. We're still getting results back, some of which are positive, but of course we're almost 4 weeks out. So our biggest problem here is, of course, the testing and the turnaround times. We now have the ability to do a little bit quicker testing. So the way our facility is, you can be tested if you are symptomatic or if you were asymptomatic and had a known exposure, or asymptomatic and think maybe you had an exposure. So they're trying to really encompass everybody so that we want to get the numbers here to really reflect what's here and not just the people that are super sick. I have the ability as people come through our drive-through, we are doing a quick assessment. There's no stethoscope or hands-on. It's really, the biggest thing, of course, is the temp and the pulse ox. Most people have taken huge doses of Tylenol, so we don't even go with that. It's really just the pulse ox. What we're finding for our patients that are acutely ill, and it's quite obvious who they are as they come through the drive-through. We can kind of put money on who's going to be positive. They're running pulse oxes in the 80s, and they don't feel it. And that's the thing that's kind of frightening. People come in and they're like, I have a little bit of headache and I have this kind of irritating cough, and my doctor said I should get checked out. And I put the pulse ox on him and it's 87. And I say, honey, turn your head the other way and cough and take a real deep breath. And it just doesn't come up. Those are the people we can then send on in. They go into a negative pressure, into a pre-ER triage area, and they work their way on into the emergency room. We have had some acutely ill that come in that are, as we see, as you guys know, and as I've seen videos like everybody else has, people just sort of, coughing their brains up. I've seen that, and they're miserable. We're seeing just a bevy of different symptoms, just like you all said. I just texted the girl that is in the clinic with me that, wow, we're missing a lot of symptoms because a lot of these neurologic things that some of you were speaking of We're seeing those, but it had not been publicly identified as possible COVID symptoms. So we're not necessarily swabbing all of them. Initially, it was you had to have a high fever, you had to have a bad cough, and you had to have travel, and all these things that sort of limited who we could test.
And that was catching like the 5% who had a poor outcome, right? And we're seeing that now potentially 50% people even don't have symptoms.
Well, exactly. And that's kind of exactly the problem. The community I live in we are at a fairly wealthy demographic. So we had a large number of international travelers and people that were just coming back from international spring breaks or heading out too. So we did have a lot of, people had come back and they said, well, I just came back from Spain and I was in Spain and Italy and France, and I have this terrible fever and this booming headache and I don't know what's wrong with me. And so you probably are positive, and sure enough, they were. But by the time we got our results back, they had probably infected half the city. So now what we're pretty strict with is the moment we put that swab in your nose, or now we have an oral one, you are on quarantine for 14 days or until we get the results back and they're negative. And with that, if you're positive, we require you're symptom-free, completely symptom-free for 7 days before you can come out of quarantine. Or if you're negative, you have to be completely symptom-free for 72 hours without antipyretics before you can go back out into public. So we're kind of hoping now that we're catching more people, and if nothing else, we're quarantining heavily. Cincinnati, Ohio has had the opportunity to have our governor shut the city down fairly soon, or the state got shut down fairly early and went on a hard lockdown just a week after that. So our numbers that we're seeing just simply aren't very high right now. Unfortunately, what we're going to see is in 2 weeks, we're going to see what is reflective of what's going on now, because the resulting is just taking too long. But our patients, they describe exactly what you all are saying without the neuro stuff. I've heard some of that, but I just didn't know, other than the migraine-like headache and the unbelievable myalgias. Just like influenza, I can see an obvious COVID on somebody, just like we can see an obvious influenza on somebody. But
you've seen enough now.
Yeah, we're seeing enough. And now I realize I've missed a lot not knowing that they were COVID, because that's just not the information that we were given to even look for. I mean, I see Christine nodding her head back there. But we're just not being told that information. Yeah. And we're very much limited based on who can run these lab results. The local lab act.
They won't. They said that they're full. Is that what you said?
So yeah. So the way this is going now is the average Joe, if any one of you, with the exception of the two physicians, that came through the line, you would go to LabCorp. That's our local lab testing. We would do now an oral pharyngeal swab, and it goes to LabCorp in a saline solution that's been vetted for this. If you're a healthcare provider, then we can get approval to send it to Ohio Department of Health. Or if somebody is acutely ill and, intensive care bound, then theirs can go to Ohio Department of Health to get a 48-hour turnaround time. They want to suss out the healthcare providers, because by now I'm understanding Ohio healthcare providers that are known, we have 20% of healthcare providers are now down and out with it, just like you all.
Oh my gosh.
So they're trying to rapidly turn around those tests because they want us back to work, and they want to know who to contact with.
Yeah. So what, have you seen that flip yet, where someone has tested positive, gone out on quarantine, symptoms have gone away, and then they've come back to work yet?
Yes, we've had a couple that are feeling better. I don't know if they've come back to work, because they would still have to be 7 days post their last symptoms. So as we were just getting results back, maybe some of them are starting to trickle back. But a few of them look kind of like Christine, I believe, and they're just still not breathing well. And that's still symptomatic. You don't have to be coughing. So I don't think we're forcing them to come back. Our hospitals are not that full. We are not like New York. We have plenty of personnel that, they've closed our medical offices, and they've pulled every able-bodied hand into the hospital. They're cross-training people for ventilators. We have thoracic surgeons who aren't working that are willing to come in and work the ER. They're just sort of redeploying people into areas where they may be needed.
That is great. Thank you so much for that firsthand view in the system. It really, really paints a very clear picture. Thank you again. I know we'll want to touch base again. I want to go to Christine right now, and say you have been in the medical system and then were pulled out when you didn't feel well. Are you seeing the same problem with testing where you are? Oop, we're not getting audio. Let's see.
I
There you go.
unmuted.
There you go. Go ahead.
I'll try to speak. It's because I can't talk like my usual loud voice because I don't have the energy.
I know.
In Bolivia, it's kind of remarkable because their response was very quick here in the country. They closed all the borders. They stopped all the flights in and out. So basically, even though my mission ends in 2 weeks, there's no way of going home. But they also stopped everything for 24 hours a day. Like nobody can go anywhere. We're not allowed to do anything. And that was with just a minimal amount of cases. I wish I knew exactly how many at that time, but probably a dozen cases or so in the whole
That's
country.
what I remember you saying me, because we talked the day that they closed.
So now we're all on lockdown 24 hours a day. Yeah. So nobody's going anywhere, and there's fines. I mean, it's not like in the United States where they say, "Oh, please stay home," and everybody's expected to stay home, but everybody goes out anyway. Nobody's going to parks here. Nobody's having any fun. Trust me, it's not fun, but it's necessary. And we're only at just over 200 cases and 14 deaths in a country of 12 million after a few weeks of this. So hopefully this is helping. Nevertheless, it's still pretty restrictive. And of course, I was working in 2 different clinics, so I was exposed to, who knows, any number of patients with all sorts of different symptoms before we were given instructions to be actually looking at patient symptoms. And I mean, we all knew COVID existed, but in the clinics here, they weren't taking anything particularly seriously until just the last few weeks. So I was exposed probably prior to that.
Yeah, probably the incubation could be up to 2 weeks. So thank you so much for sharing. Shayna, you're up in Chicago. Will you tell us about what sort of is happening in your community from a big picture? Like, are people staying in? Are you experiencing quarantine still? What's going on there? How are you feeling?
Yeah, I mean, our governor was pretty quick to put the state on a shelter-in-place order, which was good. And initially, people were paying attention. Although yesterday we had a really nice day. It was 76 degrees out, and there were a ton of people out. It was almost like a normal, when spring breaks, everyone leaves their house and they want to be outside. So yesterday was pretty bad. They had, helicopters and police out breaking up groups of people. And so yesterday was not very good. We're also
such a new reality to live with. My gosh.
Right. They converted one of the big convention centers downtown into a COVID facility for about 3,000 patients. And they had 2 of the Hercules planes drop off supplies last night. So they're only planning to use it, once the hospitals become overwhelmed. But yeah, I mean, this week and next week, we're expected to hit our peak. And I think yesterday was the highest death toll, for a day that we had here. And I just wanted to add on to some of the previous conversation. So my partner actually ended up being in the hospital for 5 days.
Oh, he did. Oh, I'm so sorry.
And he had a chest CT on arrival, pneumonia. They put him on an antiviral. He wasn't improving, and his fever was so bad that they had to ice his body down in the middle of the night.
Oh my gosh.
On his 3rd day in the hospital, they gave him the malaria medication. His second CT was actually worse on the 4th day, but by the 5th, his fever had resolved and his oxygen levels were up, so they released him. I mean, his energy's still low, but he started, getting it back about a week later. But again, I mean, going up the stairs will wind him. So yeah, but
wow. Well, thanks for that report too. I was thinking let's kind of go around again and let's share what day was really the worst day for you, or Ariana, for people you're seeing, and how quickly was that a change? I think that would be helpful for people to know. For Shayna, let's stay with you for a second. For you yourself, what was your worst day from onset of symptoms?
My worst day was probably day 2 or 3 of my symptoms. But again, I mean, mine were very mild, much less than I think in any of you on the call. And it's nothing I would have gone to the doctor for normally. But my partner, I mean, he was lying on the couch for about 5 days straight, sleeping for 20 hours a day. He started, not eating. He had, a lot of the symptoms way worse than me, just exhaustion, fever, chills, pressure behind the eyes, coughing. And then eventually, when he stopped eating as much, got really lightheaded. He passed out a couple of times. And the day I took him to the hospital, he took a shower and he had to call me in to dry him off because he was about to pass out again.
Wow.
So at that point it was like, okay, yeah, something is, I'd never seen him, like that before. So, and then he also did have, diarrhea, food tasted bad. And both of us actually had the loss of smell and taste for a while. And that's been the longest to come back for me, actually.
And so what day was his worst? You said 2 or 3 for you.
Let's see. His would have been 11. Well, I mean, the day I took him to the hospital was 9 days after he first had symptoms. But I would say probably his worst day was 11 or 12, because that's when they finally put him on the malaria medication, and he had it for so long, it was not looking good.
Wow. But he's home now, yeah?
Yes.
Okay, well, thank you. And I hope it keeps getting better. Natasha, let's go to you. What about you two? And you said your husband had it as well. So unmute your screen so we can see your face.
Can you hear me?
Yeah, but it is the echo part. But I wanted to definitely have a picture of you. Maybe mute your phone and see if the audio in the computer is better.
Can you hear me okay?
Yeah, but you gotta mute the telephone because it's echoing.
Yeah, Can you hear me okay?
Yeah, that's good. If you just turn down or move the phone away so that it's not echoing.
Okay, it's not gonna work, I don't think. We might have to just do the phone.
No, I can hear you well. Keep going.
Okay. I'd say my worst symptoms hit about day 5. I had extreme fatigue. I couldn't breathe. It hurt all the way up just to try and breathe. I started getting crackling in the lungs. I had the diarrhea, digestive issues, couldn't eat. My fever spiked to almost 103. Fatigue like I've never felt in my life, shortness of breath. I did check my oxygen stats and they were about 90, which is still normal, but below.
Yeah.
So yeah, that was really bad. And I had a high fever for about 5 days. Couldn't move. Couldn't eat. I had a stuffy nose. I lost my sense of taste and smell The third day, I still haven't gotten it back fully. I can kind of smell things from time to time and kind of taste things from time to time, but what really was the scariest for me is when I had the crackling in my lungs, not being able to even like go downstairs without being completely short of breath. I almost fainted in the shower. I just couldn't move around too much without being extremely dizzy or feeling faint. And that was, you know, really scary. I had a lot of internal shaking, which was really weird for me. And I had chills so bad that I felt like my body, like I was doing this. Like at one point, my husband had to like hold me. I was so chilled, sweating. I mean, it wasn't fun at all. So
we're so glad that you're better. My gosh. So sorry. So day 5, you say?
Day 5 through 10 was probably the worst.
Okay.
Now I'm just dealing with, you know, being tired. That's like my main thing right now. And then I do have a cough. It's starting to be more of a productive cough. So I'm able to like get some things out. But yeah, there was about 5 days where I didn't really move much. I couldn't. My body just wouldn't let me.
Wow.
Yeah.
Okay. And I'm sorry, I didn't get to communicate much with you. Tell me your name one more time. I'm sorry.
Oh, I'm Robin.
Robin, right. Okay.
Yeah.
Robin, will you report for us?
So mine started about the 19th of March. I do want to say one thing about the testing. She tested because she was high risk and they wouldn't test me. So she did test positive, but I ended up being able to be tested on Friday this last week, and I'm still positive, and I'm on day 19.
Oh, really? That is
so
interesting.
That's kind of interesting.
Yeah.
Why would they not test you when you were living with someone who was positive?
Well, here they're not testing unless you're high risk, like you have an underlying health thing. If someone in your house tests positive, you just assume you have it if you're sick.
Okay.
The only reason I was able to test is because I was diagnosed with brain cancer this summer. So that was kind of, you know, that was an underlining thing. But yeah, you actually have to go through a questionnaire in order to even schedule to be able to go through one of those drive-through facilities. You can't just like drive through it. You have to actually go onto the health department and website and apply. And then they say, yes, you're approved to come.
Because sick people really can spend time on the computer. That makes
yeah. So that was interesting. I was on day 19 and still positive. So.
And what day was worse for you?
For me, it was, let's see, probably day 4 through 11.
Okay. Yeah, that's what we've been hearing. So thank you both so much again. Elliot, will you give us your synopsis? What was the worst day for you? When were you admitted to ICU?
I was admitted to ICU on the 6th day after having symptoms. So, but again, my symptoms initially were all digestive plus fever. I never fully lost sense of taste and smell. It got a little muted, but it was always there. And so it was day 5 that I went to the ER, and day 6, actually, I started to do a little better. But then for some reason, I woke up in the morning and just could not get oxygen into my lungs, into my blood. That's when we transferred to ICU, and that night was the scariest night when I just couldn't breathe at all. So it was around day 6, day 7 that things kind of hit their peak. Also, though, I started the hydroxychloroquine on day 6. And then, you know, it felt like, again, it's all anecdotal, but it sort of felt like by day 8 that was starting to kick in and I was able to breathe a little better, and then just got better and better each day.
Thanks for that. Well, I know that I know that it must have been crazy and scary to be away from family and to be in that technological environment. I wonder if you could use that time and give us a little advice, or anyone who's listening, give us advice. Like, I loved hearing that you were able to connect over your phone with this extended community who is sending you love and appreciation and everything, but being so close to being on a ventilator yourself. What advice do you have for someone who's facing this? Like, what can they do alone in a hotel room, wherever the field hospital is? What can they do to take care of their spirit in this experience?
I was lucky. I had a Kindle, a tablet, and on our phone we have unlimited data with mobile hotspot. So I was able to use my tablet as a book. I was able to use it as TV. I was able to use it to browse the internet. And it just kind of kept me a little bit connected. On a deep level, when I thought everything was falling apart, you know, it reminds me almost, I remember this one time where there was a JetBlue flight that was needing to make an emergency landing, and JetBlue had satellite TV. So the people on the plane could actually watch the news story about them making an emergency landing. It's kind of what it felt like when I was sitting in the ICU, and every time you open up the phone, there's news stories about, you know, how bad COVID-19 is and how many people died from it today. And when you're sitting there not able to breathe at all, and they're talking about a ventilator, it's just mind-boggling. So I had to shut that off, and I just went introspective. I just started to think about my life as I was reading these messages coming in, and you know, for me, it just sort of became, if I get another chance here, how am I doing? How am I as a husband? How am I as a dad? Or how am I as a son? And how am I as a doctor and a business person? How can I be better? And I just made a lot of commitments, and I also realized that I haven't really been taking care of myself. I'm more of a giver. And so I wasn't sleeping enough. I was working too much, not home enough. And those are all things that I really committed to: taking better care of myself physically, being more around my family, and not running so fast on the hamster wheel. And those things kind of felt good. And now that I'm mostly ahead of it, I'm implementing those things, and they feel really good. It almost feels like a crappy way to get into a better track on life. So the other thing is, in my home, just FYI, none of my family ever showed symptoms. My mother, ironically, who lives in New York, came to be with us for a Jewish holiday at the beginning of March. And when coronavirus really exploded in New York and California, I was nervous about her traveling through the airports, and I begged her to stay. And then, ironically, a few days later, I came down with symptoms. But I quarantined myself immediately when I first had symptoms, even though I didn't know it was coronavirus. I kept to my own room, my own bathroom, stayed away from my whole family. My mom tested negative, and none of the rest of our family have any symptoms. Thankfully, also, we called all our patients right away, who I'd seen in the past 2 weeks, and none of them exhibited any symptoms either, as far as I know. Now it's been several weeks. So I can only hope that the CDC guidelines that we were following, and then some, in terms of sanitization of all the surfaces in the office, vigorous hand washing before and after every patient contact. Hopefully those are the things that really protected people around me.
I sure hope so too. And I think we have a nation that hopes that all of these precautions are working. As we close today, wondering if anyone has any last advice or suggestions or well wishes for the people that may see this. And then I'd like to go to Ariana to close up about medical things. Anyone have any well wishes or things to share?
I just hope that, you know, everybody stays positive and everybody shows everyone love, and not to, you know, my roommate said not to, when you are starting to feel symptoms, not to go into a state of anxiety or panic, you know, because that's definitely not good for the body either. But, you know,
hour by hour,
day by day, hour by hour, you know what I mean? And, you know, just, I know for me, like, having it, I would watch these videos and watch people talking about it, and it's an emotional thing, you know, and it's just, I just think everybody just needs to love one another and support each other, you know, and even if it's someone you don't even know, you know, I just think that that's the most important thing, because this is a really scary time for all of us. And you know, anybody that's going through this, it's scary. It is. And to stay positive and just take it day by day, you know, and support those around you, even if you don't know them, you know.
Beautiful. Thank you. Thank you for that. Shayna, can I go to you before we close tonight? Your due date is right now. You're expecting a little darling. Is this first baby?
It is, yes.
Oh, congratulations. Do you have a plan for your delivery? Has it changed from what you were originally thinking?
You know, it changed several times, you know, since I informed my midwife group that I'd been exposed. But actually, since it's been more than 2 weeks since my partner was, you know, released from the hospital and symptoms had resolved, as of yesterday, it's back to normal. But it was going to be like, you know, I couldn't use the birth center. I was going to have to be in isolation room. I couldn't have my doula attend. The midwives were going to have to be in the full protective gear with gowns and face shields. I wasn't going to be able to use the birthing tub or water therapy, because if I got wet, then it would make their gear less effective.
Wow.
So, yeah, there were quite a few things that, you know, were not part of my plan.
Wow.
So now, as of yesterday, I had an appointment this morning, and all of my appointments had moved to telemedicine. I wasn't allowed to go back to the midwife's office. You know, couldn't like get the non-stress tests done. But so yesterday was the day where it was like, okay, if I can make it to this day, then I'll be cleared and it'll kind of go back to normal. So now the only thing is they're no longer using nitrous oxide, which, you know, was maybe a potential. I'm hoping, you know, not to use any medication, but they said that there's a higher risk of like aspirating or aerosolizing with that.
Yeah.
So they're not using that at all anymore.
Yeah. Well, I'm so glad that you get to see your midwives and your partner can be with you, and that you're recovering and just at the right time. And we wish you a lot of joy and wellness there. Ariana, will you close us out today with recommendations, maybe of the more physical bent? Certainly, if you have emotional recommendations, we'll take that too. But, you know, for people that are potentially just this week testing positive or having symptoms, what's your advice?
So what we're telling everybody, and what I tell people 50 times a day or more, is everybody is presumptively positive now, because the testing is just not good. We also don't know how long you remain positive after you've been known to be positive. So you could continue to shed this virus. So we are telling everybody, if you have any symptom, if you have any contact with someone that you know is positive, presume that you're positive and get yourself into strict isolation, away from your own family, away from anyone that you could infect if you hadn't already done it. And you remain that way until you are absolutely symptom-free for at least 7 days, 72 hours. If not, if you can hold out 7 days, then we know at least people have gone 21 days without other physical human contact. We are asking them, don't present to the hospital until you feel like you need respiratory support. The hospitals can't do anything for people that are early in this. So the best they can do is give you oxygen if you need it. Most of the people, I don't want to say that they were asymptomatically hypoxic. They had some symptoms. Something wasn't right. They felt a little short of breath. They felt a little something. Go to any of the facilities that can at least get a pulse ox on you and get an idea of where you are.
Or buy it for $12 at your local drugstore.
Or whatever, you can still find one.
Yeah.
Yeah. Find out kind of where your oxygen level is. Research is showing significantly that the sooner you can get supplemental oxygen for an oximeter of 94 or less, the better the outcome is. but in general, the emergency room can't do anything until you need oxygen support. They're just overwhelmed with the people that are concerned. So we just tell people not everybody dies of this. It's actually a very small number, but a huge number gets it, and they recover okay at home. Looks like we've had a few that recovered well but had a very rough course, and not everybody has that. But going to hospitals and going out and going into other facilities, you can then expose other people that won't do well, or you can then get multiple exposures, which have been shown to increase the likelihood of a very poor outcome, because it's not a single exposure. The providers are getting multiple exposures. So the more you can protect yourself from other people, the better you are. If you have to go out, you keep your distance, you wash your hands obsessively, keep your mask on, and then go back home and leave all that crap outside of your house and don't bring it in, and wash your hands the minute you walk in the house. So we're just telling people this is 3 short months of our very long lives. And if we have to isolate for that time, then we just have to do it for the sake of everybody else and our grandparents or parents. So, but thank you all for sharing your stories. It was very enlightening. I've been texting my cohorts here saying, oh my God, we are missing so many symptoms. We're fortunate in my facility. You can just drive up and we'll test you. People are going to get medical bills for this, but at least they're getting tested. And we'll test anybody that really wants to test. So now that you all have opened my eyes, hopefully we'll find more people in our Cincinnati area that are positive, and more people listening to this will have an idea that just,
Yeah, it's a broad symptom picture.
It really is. And it's
really
not,
listening to yourself.
Listen to yourself, and utilize any of the virtual visits or any, capacity you can to get in touch with a medical provider that doesn't require face-to-face physical.
Yeah. And you know what, speaking to the, go ahead, sorry.
Oh, and that funeral home thing behind you is just killing me.
That bowling shirt.
Oh gosh, it's a bowling shirt. Oh gosh, that was good comedy. Thank you for that. Shayna, what were you gonna say?
I was gonna say, just speaking to the contagion beyond the 14 days, they do actually want me to, like, once the baby is born, wear a mask while I breastfeed and still, practice hand hygiene. And they actually recommended pumping and having someone else feed the baby the expressed milk. But since both of us, tested positive, there's not really. That
makes no sense. Yeah, Ariana's shaking her head too. All the midwives on the call are like, no.
Yeah. I wasn't really going to go with that plan anyway. But yeah, so I'm supposed to wear a mask while I breastfeed for, I don't know, I guess 3 weeks or so. Because they say, 37 days could be the contagion.
Christine, what do you have to say about that?
First of all, any separation or anything like that, no. Breastfeeding, absolutely. Having somebody else feed the baby, no. The mask, but there's been a lot of evidence, not related to COVID, that shows that the mother's, face and the baby's face and all the facial expressions of the mother are very important for that connection. I mean, if that was the make or break thing, the whole mask, I would say, okay, go ahead and do it, but it's your baby. It's going to be attached to your breast. No matter how many times you wash your hands, still there will be times you touch your baby when you don't wash your hands. If you're not currently symptomatic or you're not testing positive, I would say the risk is very low for your baby. The baby's getting antibodies from you from the breast milk. Until there's further evidence, I would say just treat your baby like you normally would treat your baby if COVID didn't exist. Again, until there's further evidence, please.
Yeah, I feel the same way. And in fact, the World Health Organization is only recommending pumping and expressing breast milk and feeding the baby separately when the mother is currently incapacitated by her treatment. So if the highest law in the land is saying nurse your baby. So if you're currently coughing, the mask is recommended. But like Christine said, this is a messy world we live in. This idea that we can somehow separate a breastfeeding infant who used to be in your body from the germs that are in your body is, I'm just going to say that one's hard to swallow. So I agree with Christine entirely. You know, the comfort from you will keep the baby's stress hormones low. The antibodies from your milk will keep the baby as protected as they possibly could be. So to me, that seems like a no-brainer, but obviously we're not your care providers. Listen to your care providers.
Well, they did say it was my call, so.
Yeah, well, good. I'm so happy to hear that. Self-determination and sovereignty is where it's at. I've been so grateful to have all of you and have this conversation. It's I think such a needed conversation with really real people. So thank you again. And if things change, let me know. I'd love to hear more. And I appreciate every one of your contributions. Thank you so much.